How's it going, everyone? I hope you're doing well. It's Richard. Welcome back to Push-Ups for PTSD and day 1303 and also day 24 of 125 push-ups a day as we travel down this road to spread awareness about mental health and suicide. First, I'd like to apologize for my upcoming attempt at Portuguese and French, and also send my well wishes to everyone watching and say thank you for your support. Stay inside and stay safe. Quiero apenas enviar meus votos de felicidades a todos que estén asistiendo e gracias pelo apoyo. Je souhaite simplement adresser mes meilleurs vœux à tous ceux qui regardent et vous remercier pour votre soutien. Somewhat windy but beautiful and warm day outside today. Can't say I spent much of it outside though, as we discovered a bunch of slivers in our youngest hand today. He had a tumble outside that we weren't aware of, and so today we had to head off to the hospital's ER room in order to get them removed. Wasn't a bad process, just long, but having to only distract one child was much easier than it's ever been in the past. Happy to say we were able to get all 10 slivers removed, and now he's happily at home. Back in today's daily topic is 3 more common treatments for PTSD. The next one is eye movement desensitization and reprocessing. With EMDR, you might not have to tell your therapist about your experience. Instead, you concentrate on it while you watch or listen to something they're doing. Maybe moving a hand, flashing a light, or making a sound. The goal is to be able to think about something positive while you remember your trauma. It takes about 3 months of weekly sessions. The next method or treatment is stress inoculation training. SIT is a type of CBT. You can do it by yourself or in a group. You don't have to go into detail about what happened. The focus is more on changing how you deal with the stress from the event. You might learn massage and breathing techniques and other ways to stop negative thoughts by relaxing your mind and body. After about 3 months, you should have the skills to release the added stress from your life. The final common treatment type is medications, and quite possibly one of the longest lists. The brains of people with PTSD process threats, air quotes in there, differently, in part because the balance of chemicals called neurotransmitters is out of whack. They have an easily triggered fight or flight response, which is what makes you jumpy and on edge. Constantly trying to shut that down could lead to feeling emotionally cold and removed. Medications help you stop thinking about and reacting to what happened, including having nightmares and flashbacks. They can also help you have a more positive outlook on life and feel more normal again. Several types of drugs affect the chemistry in your brain related to fear and anxiety. Doctors will usually start with medications that affect the neurotransmitter serotonin or norepinephrine, including Prozac, Paxil, Zoloft, Efferix. I use their shelf name as the medical names are a little bit more difficult to pronounce. The FDA has approved only paroxetine and sertraline, which is the Paxil and the Zoloft, for treating PTSD. Because people respond differently to medications and not everyone's PTSD is the same, your doctor may prescribe other medicines off-label too. That means the manufacturer didn't ask the FDA to review studies of the drug showing that it's effective specifically for PTSD. These may include antidepressants, monoamino oxidase inhibitors, MAOIs, antipsychotics or second-generation antipsychotics, beta blockers, benzodiazepines. It's okay for you to use medicine off-label if your doctor thinks there's a reason to. Medications might help you with specific symptoms or related issues such as mini-press or insomnia and nightmares. Not much time left, so I just want to say through all of this, I hope everyone out there is doing well, no matter how crazy it may be inside or outside. It's just a moment in time and it will pass. Take care of yourselves and stay safe. Thank you for your current and future support, and most importantly, thank you for surviving. Take care of yourselves.